This is Healthcare Now Radio's Talking the Walk. Come along with us as host Tom Testa and his guests discuss the strides being made toward actionable changes in the industry. It's a fast-paced 30 minutes, so keep up. And now, here's Tom Testa.
Hello, everyone, and welcome to Talking the Walk. I'm your host, Tom Testa. I'm joined today by Julia Rosen, the Senior Vice President of IT for the Medical Group Management Association, or MGMA. Julia has held top technology leadership roles across healthcare, including CIO, CTO positions at ParaHealthcare and Centura Health, where she helped stand up the technology infrastructure behind Colorado's COVID mass vaccination sites. With 15 years in healthcare IT consulting and a passion for modern patient experiences, health equity, and advancing women in tech, Julia brings both strategic vision and real-world execution to the conversation. Julia, welcome to Talking the Walk.
Thanks so much for having me, Tom. It's great to be here.
Well, it's great to have you, Julia. That was a little tease there, but I'd love for you to give our listeners a little bit more background on yourself, and especially like what inspired you along this amazing journey we just talked about that ultimately led you to where you are today with MGMA.
Sure. It's a great question. So I've spent most of my career in health tech. My very first job out of college was for Epic, the electronic medical records company. And so I've done that really my whole career, first in consulting and then leading IT for provider organizations. And I would say what's really always motivated me to be in the field and stay in the field is that technology is such a great way to improve access to healthcare and improve the ease with which people operate within the health systems. We've all had the experience of being patients, or we've all had the experience of having family who've been at the mercy of this complex, really difficult to navigate healthcare system. And you kind of have a feeling of helplessness when you're there. You're just at the mercy of all these professionals who are fantastic, but working in a system that you really don't understand. So, I've always thought the technology is such a powerful tool to make it all work, to improve health equity, to improve the patient experience, to improve the way that our healthcare systems operate. So that's why I love it. That's what keeps me coming to work every day. And that's where this opportunity with MGMA is such a great fit for my passion and background. MGMA, well, I'm sure we'll talk about this later, but it's an organization that is dedicated to being a resource for medical practices to improve one of the most challenging parts of healthcare, which is the business side of healthcare. Anyone who's been in healthcare, worked in revenue cycle, healthcare operations, it is so complex. There are so many requirements from a regulatory standpoint, from a technology standpoint. And so MGMA is really designed to serve medical practices to improve that for them and allow the business side of their practice to run more smoothly. And so that just is such a fit for my passion and for how I want to use technology to help simplify access and simplify the way that the healthcare system works and improve lives for patients and families ultimately.
And it's funny because we talk about, or maybe it's not funny, but we always talk about how technology is continuously improving, especially on the clinical side, tech used for clinical, but you've probably seen a great deal of that too on the financial side, the new technology, the new systems being able to better the jobs of your base, right?
Yeah, absolutely. I mean, honestly, the less time that the practice needs to spend on things like billing or resolving issues with patient schedules, or even something as simple as ordering supplies for the practice, streamlining that. There's so much that you can do with technology to improve those things. And the less time the practice has to spend on those, obviously, the more time and money they have to improve patient care. So ultimately, that's what it's all about, right?
No, that's great. And let's actually talk a little bit more about MGMA. I know you gave us a little bit about the mission statement, about who you serve. But let's talk a little bit about the history if you can, because
Sure.
Again, this is part of a series we're doing on really getting to know the associations that impact the healthcare space and stuff like that. So I'm so grateful to have you here. Talk to us a little bit about that history of MGMA.
Yeah. So MGMA is actually 100 years old, if you can believe it. So I know.
Wow.
Yeah, and it's funny. I was looking at a hint. I got a preview of some of the questions today. I don't know if I'm supposed to share that, but
Okay.
one of the questions you asked later on, Tom, was really about how the needs of MGMA members change. And it's interesting because when you look at our 100-year history, I actually think the needs haven't changed that much, right? here's what medical practices need and want, right? They need education, they need training, they need the tools and the information and knowledge to run their practices well, again, so they can focus on patient care and better serve the community. That's what MGMA has been about for 100 years, right? That hasn't really changed. The way we deliver it, it has changed. So, we're pretty well known for our large benchmarking data sets. It used to be delivered in a book, right? You used to get a book with all of the benchmarking data that we had, and now it's being delivered in a modern software platform. So I think in terms of why MGMA exists, it's really to help medical practices succeed in the business of healthcare. And we do that through government advocacy. We do that through training, certification, tooling, facilitating ways that members can connect with each other. So that's what MGMA has always been about. And, the tools that we deliver those services have evolved over time, but we really exist, to serve the members and advance the business of healthcare. And that's always been the same.
That's great. And I want to get back into that 100-year birthday. And I want to talk about some of the services and the educational components you offer and the resources in a little bit. So that's great. A little bit back to the who makes up your membership. You teased it in the answer to your first question. Dig in. What kind of organizations, individuals really make up the heart of your membership? And how many members do you have, if you're okay with telling us?
Absolutely. So we have about 70,000 national members, and those represent about 15,000 medical groups of all practice sizes. And it's interesting when you go online and you look at the AI summary of who MGMA serves. Some of the AI engines will say that it specializes in small to medium practices, which actually, again, we really serve all levels of practices. So most of the huge health systems in the country, we work with because they really are interested in our benchmarking data, but we also have really small one provider medical practices who are members because they want to network with other practices. And when I think about the individuals who are typically members, Tom, we did an exercise this year where we did persona mapping, who's the typical MGMA member? And obviously there is none. We have a wide variety of members in different roles, but one of the MGMA personas that makes up a lot of our members we call it sort of the superhuman multitasking practice manager. Okay. And there are these people who are in these business roles at the practice. They may be the only person in a business role at the practice, and they oversee everything from billing to supply ordering to scheduling, to the technology decisions. And I think, and I want to call that out because I think one of the things that MGMA does, particularly for those type of members, is create a community. That's such a lonely role. Often those people are the only person in their whole organization who does what they do. And so they're constantly seeking out, knowledge to improve the way they do their work, something that they probably can't get internally within their practice. So when we talk about there's lots of different personas who are MGMA members, lots of different practice sizes, everything from the behemoths to the one provider practice. But, I do want to call out, we really try to create community for those folks who are really the only business person in their practice and be a resource for those people to improve their jobs where they might not have resources elsewhere. So yeah, it's a really a diverse group, but we try to make sure that we're serving all types of members and creating connections for them.
That's great. 70,000 members, and I'd imagine in all 50 states. And, what a great resource for these folks, especially like you said, like those individual superhero, individuals who are kind of the point person for making sure the business side of a practice is run smoothly. That's fantastic. So, I think I've got a good idea of the answer, but I want to hear from you. If you were to give that elevator pitch, kind of like, so you've already talked about a lot of reasons why, but why join MGMA? Here I am. Even at any level, whether I'm big, I'm small, I'm ready. Why would I join MGMA and MGMA?
Yeah. I think it's obvious that everyone that works with healthcare that sustaining a medical practice these days is becoming increasingly challenging. One of our members, I just heard the story. One of our members was talking to one of our MGMA leaders, and they said, every year my costs reliably increase by 3 to 5%, and my reimbursement reliably decreases 3 to 5%. that's a really tough way to run a practice, right? Any business, but especially one where you're trying to deliver healthcare. So I would say, why join MGMA? We are here to help you solve those type of problems, right? We are here to make you help you be financially sustainable, to be operationally strong, and again, particularly if you don't necessarily have some of those resources readily available to you, we are here to be that provider. So that's why I joined MGMA, to improve the business of your medical practice. And also, I mentioned already, to connect. I think we have, I should have mentioned earlier, we are a national organization, but we also have state level chapters as well. And so those state chapters also provide a really valuable connection and networking opportunity for people to find like-minded people who can help, who can share best practices, and just again share what it's like, and feel a community of people who are trying to do the same thing, which is a real challenge in today's regulatory and financial environment. And the other thing I'll mention too, I'll throw it out there. I think we have an online member community, and I was just there just this morning exploring some of the topics. I mean, literally, people are bringing up everything from what's the best e-faxing solution to my practice, to, what are your strategies for payer contracting conversations, to how is your office celebrating the Super Bowl, right? So it truly is a community and an area to just get ideas for how to improve things in your practice across a wide array of business topics.
That's great. And, earlier you talked about too, that the needs and interests, you said they're changing a little bit, but maybe not so much, even based on the 100-year history of what your members have asked for. So, but and not to bring it up, but we've been through COVID and things that have kind of like been these big disruptors, not just COVID, but AI, other technologies, right? So how does MGMA address things like that when they pop up?
Yeah, I mean, I think one of the things that we continually do is we're really keeping our eye on the pulse of what's changing. What are the big external factors that can impact your practice? So, as an example, we have an advocacy office in Washington, D.C., who really is at the forefront of understanding all of the changes that are going on in Washington, so we can share with our member community and help them prepare. Right. Provide a toolkit, provide information that's going to help them prepare. From a technology perspective, one of the things I'm always doing is looking at how are the regulatory changes going to impact systems, right? Mm-hmm. What's the newest research in how threat actors are targeting the healthcare community, and sharing that with our members. So we try to be an aggregator of all of the external economic and operational things that are happening in the broader sort of national sense, and help practices figure out, how is this going to impact me? What can I do to prepare? What are things I need to be thinking about now, that may come up in, the next year, 2 years, 3 years, and help them build that plan for their office. So I think that's one of the things we're really doing to help our members navigate the changes, is to, in some ways, just stay on top of it for them, so they don't feel like they have to know everything about what's going on in the business of healthcare.
That advocacy work is huge, I think, especially when it comes to organizations like MGMA. How, you talked about making sure that you're on the front lines for your members when it comes to advocacy work. Are there things you see, anything, and I understand, you may not be one of the members of your legislative team, government relations team, but are there things that are right now a big focus on the advocacy side?
I mean, reimbursement always is, right? And that's just a constant. We're always looking at what are the changes in Medicare, Medicaid reimbursement structures, not only looking at those changes, but also our advocacy team are viewed as experts in the area. And they're actually relied on, by many of the folks in Washington to understand what the impacts of these reimbursements might be to the healthcare community. So it's actually, I think, a two-way street. We kind of help view what the changes are and share how that will impact our practices. And then in addition, Washington is relying on us to share with them, how potential changes could impact the industry. So it's a two-way street. And I think, our team there is amazing, super effective. And actually, I should mention as well, today, as we're talking, one of our board members is actually testifying before the U.S. Senate Special Committee. And the title of the talk is around how Washington's rules drove physicians out of medicine. So it's really about the impact of some legislation on, physician retention in the industry. But it's just a great example of sometimes there are laws or regulations that come out that have unintended impacts. And I think we try to anticipate those and share that information with the broader legislative community.
If you're just tuning in, you're listening to Talking the Walk on Healthcare Now Radio. I'm Tom Testa, and joining me today is Julia Rosen of the Medical Group Management Association. Julia, that's fascinating about what you're doing, the work on, Capitol Hill and on the advocacy side. I want to talk now a little bit more, swing a little bit back into the resources you offer. I know MGMA has especially some big conferences, annual conferences. Can you talk about first the events you offer and when or the next one we can expect?
Sure. We have a couple upcoming. We have a series of 3 conferences in the spring. Our financial focus conference, March 1st to 3rd in Phoenix, operations focus conference, April 12th to 14th, and then a private practice conference, May 3rd through 5th. And that's really kind of focusing on all aspects of practice management. And those, I'm really excited about those conferences because they're typically smaller, more focused groups. And so we talked a little bit earlier about some of the roles within these practices on the business side that can feel really isolating and also feel like, I know I need to improve things in my practice, but where do I start? So those events are just great opportunities for people in those areas to connect with other leaders that are like them, share best practices, learn about what's going on in the industry. And it's really relevant to kind of their microcosm, their specific area of influence. So super excited about those. And then we have our large annual conference in September.
In September. And where's the one in September? Do you have a location?
It is. It's in San Antonio.
All right. Excellent.
Go visit the Riverwalk while you're working on your medical practice. So.
Awesome city. No, and again, this is you educating me. Is this for just MGMA members, or if I'm not a member, can I show up to an event? Who are they open to?
Yeah, you can absolutely go to the event. So we do have, shameless plug. If you're a member, you do get better pricing at our events, but anyone is welcome. And we do truly have people from all over the country, but B, in a lot of different areas of the industry attend our events. We talk about everything from technology to operations to, financial optimization. It's really all aspects of the healthcare business.
Well, that's great. You've got some great programming, great events for members and non-members. You're an inclusive, obviously, community. What about the other resources you offer, educational resources? When we're not at events, I know you have local chapters who are probably throwing events, but other non-event stuff, what kind of resources can I expect as a member?
Yeah, so a few different things. So obviously we have a lot in our training and education and content space. So we have very, very frequent webinars. We have a certification program that's really well recognized in the industry for healthcare business professionals. I already mentioned, but our member community is a huge value for folks who are trying to just connect and understand what other peers are doing. That's an online member community. And then, of course, we have our data platform. So that is a nationally recognized tool, benchmarking tool for all sorts of data that you can use in your business to figure out where you stand. We're most famous for our data set around physician and staff compensation, but we have a ton of other benchmarking data sets, anything from staffing ratios to all sorts of other examples of data that you can use in your practice to optimize operations. So that's another big resource that we have that we make available, depending on your level as a member, that you can have access to.
That's great. And I also, being that we're on a radio show, having my news hat on, I love the idea that you're also a news and information hub as well. You've got your insights publication and things like that, which is a great resource for members and even non-members.
Yeah, absolutely. I talked a little bit before about our government advocacy team, but that's a huge benefit that a lot of people find valuable as a member. You get to understand a lot more about our insights in the government advocacy space and how to prepare your practice. And of course, we're always generating content for both members and non-members that can help folks who are in the medical business field.
That's great. Well, let's talk about data. MGMA recently released a new version of its Data Dive platform this year, which aimed at improving usability and performance for users. What can members expect from future Data Dive improvements? Talk to us about it. What does this all mean?
Yeah. So right now, I would say Data Dive is a really fantastic benchmarking platform. So you can go into it, you can compare, the national, the national standards, the median, 25%, 75%. For example, how you compensate your staff. You can look at that and compare it to your own data. You can slice and dice based on your specific location, your specific specialty. So there's a lot you can do with it, but you really have to know how to use the platform and know what you're looking for. In the future, we want to make it a true analytics and insights platform. So, imagine a world where, you have your data in there and you have the benchmarking data, and it'll automatically come up with some suggestions for things that you can change in your practice to get it more aligned with benchmarks. Or you can query it in English and ask it a question, and it produces an answer. So, and I'm not promising that these are things that are going to get done this year, but we are really, really transitioning it to a true data intelligence and insights platform. So you can use it to really find solutions for your medical practice, not just mine the data. So super excited about that. Obviously looking at integrating AI and other technical capabilities as well. So just some things you can expect for the future roadmap.
And does the platform, is it tailored to if I'm a big medical group versus a one-person shop? Is that how it works?
So how it works is actually you can slice and dice based on what type of data you're looking for. So if you want to look at data for pediatric practices in Oklahoma City metro area, as long as we have enough benchmarking data to produce that benchmark, you can look for it. So it really is kind of tailored. You can really tailor it to exactly what type of data you need based on the demographics that you represent.
That's great. That's great. So really you can hone in on those specialties as well. And it's great. Okay.
Yeah, absolutely.
Excellent.
Absolutely. Yeah. And I will, again, another shameless plug here. I think one of the reasons that our data benchmarking platform is so valuable is because providers trust us with their data. So our benchmarking data is only good at the data we get through our annual data survey. And so again, I think we're so successful because we are a nonprofit. We have such trust in the marketplace. And so a lot of healthcare providers that maybe wouldn't want to submit their data to a for-profit database submit it to us. And so it is really valuable because we have this rich source of data. And, I will say members, I would encourage members who don't submit data today to consider submitting data because, our benchmarks are only as good as the rich data that we can receive and process and aggregate.
That's great. And Julia, let me tell you, no plug is shameless on Talking the Walk. Love to hear from you. Trust me, it's great.
I'll do a lot of shameless plugs. Don't worry.
Plug away. That's why we have you. We want everyone to hear about this great organization. So please, I love it. Speaking of, we talked at the top of our interview. We've got a few minutes left. How MGMA is turning 100 years old this year. Talk to us about what you're doing to celebrate this huge milestone.
Yeah. So there are a lot of things that I can't reveal at the moment. A lot of things we really want to use it as an opportunity to celebrate our members and our member community, right? Because that's what makes MGMA. It's not about us; it's about the members. And when I say members, I'm not just talking about national members. I'm also talking about the members of our state chapters. So we're doing a lot to celebrate members. The one thing I will say is we really are planning on making our annual conference a really celebratory event this year. I don't know if you can ever say a conference is a rager, but whatever the conference equivalent of a rager is, not from a party standpoint, but just from a celebration standpoint, a magnitude standpoint, that's really what it will be. I think it will have our best and richest content yet, amazing speakers, also some opportunities to celebrate. So, I would say anyone who wants to come celebrate with us, celebrate our member community. Again, that's in September, and that'll really be our flagship event to recognize the importance of being in existence and serving the business of healthcare for 100 years.
That's excellent. Well, wishing MGMA 100 more and exciting times. But no, I mean, I'm grateful for the tease, even though you couldn't give us the breaking news here on maybe who the celebs may be, but that's okay. That's
what's funny? It's so secret. I don't even know who they're considering. So
that's smart, I guess, right? Not you don't look like someone who's just going to start blabbing away on live radio, but yeah, no, I get it. Okay, well, awesome. Well, best of luck to you guys there, Julia. Anyway, any information on how to become a member? Anything you want to share with our audience before we sign off here?
Yeah, so I would just, if you're interested more in membership, in joining us, I would go to our website, mgma.com, and we have information there. You can join as an individual member from our website. And the other thing is we really value our organizational members. And so if you're interested in becoming an organizational member, and there are a lot, varying levels of benefits depending on your size, you can go to our website, find information on how to contact someone on our team who will meet with you and share more about that.
That's excellent. Well, Julia, this has been an amazing conversation. Thank you so much for joining me. I've really enjoyed it.
Thanks so much, Tom. Thanks for having me.
Of course. Thank you. Julia and everyone listening, if you'd like more information on MGMA, as Julia said, you can visit their website, mgma.com. You can also connect with Julia and MGMA on LinkedIn. Thank you for joining us today on Talking the Walk. Tune in to hear us weekdays at 8:30 a.m., 4:30 p.m., and 12:30 a.m. Eastern Time. You can also find all our episodes on the Talking the Walk program page on healthcarenowradio.com. If you're walking the talk, we want to talk to you. Connect with me on LinkedIn or by filling out the show's contact form on healthcarenowradio.com. Until next time, keep walking your talk. I'm Tom Testa. Take care, everyone.